up, Porter County, and welcome to yet another edition of the PoCo Wellness Hour right here on WVLP 103.1 FM. Your voice for community radio and your show for health, community connection, and overall well-being. I'm Demetrius Lewis, Communications Manager for the Porter County Health Department. Now, if you're unfamiliar with the PoCo Wellness Hour, we like to shine a spotlight on the incredible health initiatives that shape our community and the powerful partnerships that make it all possible. From local organizations working to improve public health to the innovative programs led by the Porter County Health Department, this show is your guide to stay informed, inspired, and engaged on your wellness journey. So please sit back, relax, and enjoy today's conversation about building a healthier Porter County together. Now today I have two very special guests in studio with me today, Carrie Honeycutt and Sam Burgett. Ladies, how are we today?
Great.
We're doing good.
Thanks for having us.
Absolutely. Thanks for making an appearance on the PoCo Wellness Hour. Let's start the show off. Sam, I feel like a lot of people might know you, but Miss Honeycutt, I'd like to take this opportunity to introduce you a little bit, and of course both of you, but maybe you can introduce yourself, talk a little bit about your role, and just how long you've been in the community here in Northwest Indiana.
So I'm a care coordinator for the Porter County Health Department. I started in December of 2023. But I have worked in Porter County over, I think the last 10 years or so for a local social service agency, and I've always kind of connected individuals to resources. And then prior to that, worked in Lake County with the Community Mental Health Center many years ago, and then free clinic for those who didn't have insurance, and connected them with resources and medications. So kind of been doing all this for a while now.
You have. What about you, Sam? Let's talk a little bit about your background and how long you've been here in Northwest Indiana doing your thing.
Yeah, I grew up in Benton County, an hour and a half south of here. I actually moved to Valpo back in 2016 to go to school. It was pretty much that same time that I started working in the correctional arena in Porter County, and I've been here ever since.
Awesome. And you've been doing good work ever since. So I want to talk a little bit more about your backgrounds, ladies. Let's start with you, Sam. Can you talk a little bit about what inspired you to pursue your career in social work? I know we've talked a little bit about this in previous episodes and personally with one another, but share with the audience just a little bit about how you got into the line of social work.
Yeah, sure. I always say that I didn't really choose social work. Social work chose me. I was born to do it. I definitely remember being in elementary school, asking my mom to help me organize food drives and other weird things like that. I just felt called to serve in the community. I never really thought about the field of corrections, and I actually didn't know what social work was until I got to undergrad at Valpo University. When I was in high school, I was a CNA, and so when I came to VU, it was actually to go to nursing school. So I did 4 days of nursing, realized that I actually hated all of the medical components.
A whole 4 days?
A whole 4 days. And so I was scrolling through the catalog thinking, what in the world am I gonna do with my life if it's not nursing? And I came across social work, and reading the description, I thought, man, this is what I've been doing for all these years. I just never knew what it was called. So that's how I entered the field. I never intended to work in a correctional setting. I actually was running a program for teens in Valpo, and I had a few kids that were getting arrested. They came out with all these new bad behaviors and clearly thought of themselves as bad kids because they had been incarcerated, and they acted out more as a result. And so I approached one of my professors at the time and one of my classmates and said, I think that I'm supposed to start a mentoring program at the detention center. Can you help me? And so we started out running just a biweekly mentoring group there. I totally fell in love with the population, started working there as an officer while I was still in school, and then saw more of the gaps in the justice system. So that led me to research other reentry programs throughout the world. Actually, I had the opportunity to go to Norway and study their prison system, and so I pulled all these different components of my research together and pitched and designed and ran a new reentry program at the facility for the kids. So I'd work with them while they were incarcerated, help them transition back out. And then around that same time, I had the opportunity to launch something similar in Westville Prison, about 25 minutes away. So that was how I got into the field. I kind of combined those programs and turned it into a nonprofit back in 2019. And then it wasn't until I was in grad school getting my master's in social work that I learned about police social work, and the timing was perfect in that within the region, within Porter County, specifically Valpo, they were looking to launch a police social work program. So that's how I fell into the role of police social work, and I've kept the nonprofit, the Community Change Center, running and expanding since back in 2019 when we started it.
So it seems like you've always had a passion to help people. You've always kind of been on that path. It'd be fair to say that you've zigzagged a little bit, but you have stayed on that path. Is that fair to say?
Yep, agreed.
Okay, absolutely. That's a great story. Carrie, can we talk a little bit about what a care coordinator does and just explain that a little bit?
So what a care coordinator does, in my eyes, is helping to connect individuals in the community with resources, whether it's helping them to find housing, and by that I mean connecting them with the organizations that help with housing, food pantries, but then also there's a medical component too, and being with the health department, if someone needs to find a way to afford their medication or find a new doctor, they're new to the area, so I can assist with making those recommendations, finding low-cost medications. Individuals a lot of times don't know that drug manufacturers offer patient assistance programs that, depending on your qualifications, you can enroll and get those medications for free. I honestly give scenarios about individuals I help rather than this cookie cutter description of what I'm doing. So it can be really just anything.
Understood. So you talked a little bit about your past, about how your previous jobs, you've always been a helper of individuals as well. So what inspired you to take on this care coordinator position with the Porter County Health Department?
So I saw the job description and I read it and I was like, oh my gosh, this is perfect. It's everything I've done all my life that brings me to this point, whether it was working in a community mental health center like 30 years ago, I'm kind of giving my age, working as a pharmacy tech in the pharmacy, and then running a medication assistance program for a free clinic in Lake County, and then obtaining actually a business type degree later on in life when my kids were in school, and then moving on to expand on that, but then ended up in social service and management and helping those programs that maybe help prenatal moms, families with young children, and just being out in the community connecting with other organizations. And it just kind of is all my experience lumped into one. And plus I'm also kind of the go-to for family, friends, to just help them kind of navigate and figure things out. Not afraid to dig in and find help.
And get in there.
Yep.
I must say, I had never heard of a care coordinator before, we hired at the Porter County Health Department and I ultimately met you. So it's been a real experience kind of learning what you do on a day-to-day basis and how you help people. You touched on this a little bit earlier, so for our listeners who may not be really familiar, can you describe what a day-to-day looks like for you? I know 2 days might not necessarily look the same. You kind of touched on this a little bit earlier. What's that day-to-day like for a care coordinator at the health department?
So one day is never the same. We have, a bike program. We have some Lyft transportation, so I may be screening a bike application, reviewing it, reaching out to that individual who needs that for transportation, scheduling a Lyft ride, somebody calling and saying, I moved to the area, I need to find an eye doctor, but I have no insurance, so connecting them with local resources for that. I have a couple that just call and check in with me and update me on some things going on and that I've helped them with. And I never know. So it can be anything.
That's a really, really nice part about your job. Like you said, no 2 days look the exact same.
No. And then there's meetings and all of that too.
Oh, yeah.
So
The meetings that take up a lot of time. Totally get you. I want to move on to my next question. This question is for both of you. We'll start with you, Sam, if you don't mind. What are some of the common challenges that you see residents face here in Porter County?
There's a handful of heavy hitter issues that seem to be pretty common referral reasons. Definitely mental health and substance use, housing insecurity and homelessness. Increasingly, I've been getting a lot of aging referrals for people who really are at the point where they should be placed in a facility, but for a multitude of reasons are struggling with that, or their families are. And usually, those are a lot of the most common ones. And oftentimes it's not just one issue, it's a combination of those.
Understood. What about you, Carrie? What are some common challenges that you see, because you see people on a day-to-day basis with the Porter County Health Department?
So a lot of what Sam said, a couple that I might have that vary from her is individuals can't afford their medication, maybe their co-pays, a couple $100, and they're a senior on fixed income and they can't afford that medication. So really trying to help them find something, a program that can cover their cost, discount cards and things like that. I also get senior calls as well. I think transportation and housing are a huge area, so those are a lot of my referrals.
Understood. Sam, I want to talk to you about this next question. So you're a social worker for the Porter County Sheriff's Office. So being a social worker that's embedded in law enforcement, can you talk a little bit about the benefit that that plays to the community?
Yeah, I had no idea of all the benefits when I came into this position. It's really a perfect partnership between social work and law enforcement. Being embedded within an agency gives access to a lot more information and resources and tools than external to a law enforcement setting. So for example, when we actually hired a second social worker at the Sheriff's Department almost a year and a half ago now, and so now she and I each morning review police reports from over the past 24 hours or so, and that gives us insight into who in our community is really struggling and starting to have that engagement with law enforcement. A majority of calls to 911, it's actually irrelevant to crime. There's no, it's nothing illegal happening. It's people needing help and not knowing where to turn. So access to those records lets me kind of try to proactively reach out to people to get them connected, ideally before they have to enter that state of crisis to get services. It's also just really amazing to kind of see our different cultures come together. So for law enforcement, they get to see social work as this new tool, so that, we're kind of at the point where all of us recognize that they don't want to take people to jail when they, because it's a housing issue or a mental health issue.
Right.
But for so long, there just hasn't been other feasible options. And so to be able to kind of teach each other how the different positions operate and then work together to try to divert people away from the system when appropriate to do so has been really incredible. Being within a law enforcement setting also allows me to do new trainings with law enforcement. So, for example, I run a trauma-informed justice response training for our new correctional officers in the jail. So I actually get to train them in the trauma, the high rates of trauma experienced by those who are in our jail, so that we can better interact with them. But also I get to touch on the vicarious trauma that law enforcement or correctional officers, first responders in general experience when they're engaging with such a vulnerable population. And so then I get to help them better take care of themselves so that the whole community is healthier. So I would say the access to knowledge and resources and just having the support of law enforcement in this work is extremely valuable as we work on taking more of a community level approach. It's not just, I mean, we're dealing with people, you know, on their worst days and people who are in crisis, but also by being within a law enforcement agency, there's a lot of credibility that comes with it and a lot of connections and support that then allows us to keep building a stronger system so that we're like, you know, we're helping to develop the community rather than just waiting until people are in a bad place to seek services. Understood.
And it's that teamwork aspect, that collaboration.
Absolutely.
I want to ask you something. Not sure if you know this, but are social workers, is that a common position in law enforcement with police departments and sheriff's offices? Is that something you can talk a little bit about?
Yeah, it's definitely a developing field. So police social work in some form has actually been around for hundreds of years, but it was not called police social work. So really, it was female officers who were just recognizing that people needed help, and so they were, you know, giving referrals and trying to connect people with services. But over those years, it's really become more formalized. So Griffith PD was the first one in our region to have a social worker. She's been there for several years, I mean, quite a few years now. But other than her, it took up until me being hired at Valpo to really start to develop that in Northwest Indiana. And it's actually, the statistics are so good and departments are seeing so much success that social workers are increasingly becoming embedded in kind of non-traditional settings like emergency rooms or fire departments, even libraries, different settings, just because we're recognizing the benefit of it.
So you were part of that initial spark to get social workers going in Northwest Indiana.
It was pretty stressful, but pretty cool to get to kind of build it from the ground up. When I started at VPD in 21, I was given a computer in a conference room and told, like, we don't know what exactly you're going to do, but do it, and let us know what you need. And so on my first day, I remember Googling police social work just to see if I could find other program models, and one article popped up online about an agency out of Kentucky. So since then, I have partnered with a professor at Valpo University, Caroline Van, who is publishing on police social work, and actually took our data from VPD for police social work and published that so that we can help develop the field in academia as well, so that over time, you know, new police social workers have some type of a model to go off of. Like, ultimately, a community, the program has to be built around the community's needs, but just to have examples to go off of will be very, very beneficial for agencies in the future.
It's a nice little guideline, just something to kind of read off.
Yes, exactly.
Totally get you. So Carrie, let's talk a little bit about your position, ma'am, within public health. So how does your role kind of extend beyond traditional public health care into community wellness? Like you said, you're that connection to care that a lot of people depend on.
So I was listening to Sam talk, and I'm like, gosh, I haven't done that much. But knowing that I'm fairly new in this position, kind of probably starting like you did with Valpo PD and kind of making it what it is. And as I'll be honest, when I started, I was like, well, shouldn't we all just be helping each other and working together? And why does it have to be a thing? And it's not always the case, but I will sometimes work with environmental and help get them if they've got a situation where someone might have housing that's needs repair or something. The director will reach out and say, hey, do we have any resources in the county that might be able to help? So I've worked with him a couple times and gave him a couple resources. Sometimes I'll reach out myself, you know, it depends. Or I can reach out with someone. It just depends on the individual I'm working with. If they need that help reaching out, or, you know, a little extra helping hand, foods, you know, if they've got someone maybe needing medication for treatment because they can't work in the food industry at the moment, then I can get them, you know, connected with affordable medication. And sometimes that comes from nursing, and then depending on what comes in for our nursing appointments, it just all varies, and I think it does for you as well, Sam. it's hard to predict what it is. I always tell individuals I know of a lot of resources in the county, even in Lake County. I don't know everything, but I have some good partnerships, and a lot of us bounce things off each other, and we'll say, hey, do you know about this, or do you know about this, and kind of the community resource network group that we have. So, but I definitely work, and we all work together as a team in the health department, and also going and doing outreach with them.
Absolutely. Let's move on to the next segment, because this is the real reason why I have you ladies here. We want to talk a little bit about Find Help Porter County. We want to kind of plug this and make sure that our audience understands what this website is, what this resource is, what this tool is. Who would like to kick off and talk a little bit about what this is?
I'm gonna let Sam do it. Yeah. This started with her vision.
I'll just start with where the site began back probably about 4 years ago at this point. So when I started at Valpo Police, I was recognizing how much time I was spending just trying to find good contacts at all the agencies and learn the local resources, and then there'd be staff turnover, and so then I would start the process all over again. And so I was seeing a need for a community networking opportunity, but also for a uniform resource guide. So basically, after I'd been in my role for a few months, I sent out a letter to every agency I'd interfaced with, and I said, I'm starting at that point we called it a community partners network. We're going to meet monthly. I hope you will attend. And we actually had an incredible turnout for the first one. People had been we'd all been needing something like that meeting. And so over time, the Community Partners Network turned into our Community Resource Network. And so at this point, we meet once a month, and it's grown to include somewhere around 150 or so agencies throughout the county and surrounding counties, whether it's nonprofit or governmental, whatever type of agency. And partially, the goal is network every month and keep each other in the loop about agency changes, resources, things like that. But then what we were seeing as a whole group is that none of us were pulling from a uniform resource guide. Therefore, community members were getting different referrals depending on which of us they were sent to or found somehow. And so what we did is we all, as a big network, came together and said, okay, where are you pulling from? What guide are you using? We had like 5 different variations of resource guides floating around throughout the county. So we started exploring. We looked into each option to see what would be most effective and efficient. We knew we needed something that was online and that would allow service providers to update their own information, because the problem with those 5 guides that were floating around is all of them, you could spend weeks, months, years putting one together, and then the next day something in it is outdated.
Frustrating.
Yes. And so we knew that we needed to really empower all of us to update our own information so that it's not falling on just a few people to keep everyone's info updated somehow. That's not realistic. And so we explored a few different online options. As a network, we agreed that Find Help was the best route to go. And so since then, we have been working to build up that site. So initially, I just started looking for sponsorships within the network and asking our network members to go out and find sponsors. So we were able to cover year 1 of the paid white label site that way. And then I was talking with the health department, and they said, actually, this would make sense for us to support ongoing. And so the Board of Health essentially adopted that initiative, knowing that we would continue to be in partnership with the Community Resource Network. So now Health Department and Board of Health fully funds it, and then the Resource Network, we're really responsible for making sure that the site is what the community needs it to be and that info stays updated. So over the past probably couple years now, Carrie and I and our other social worker at the Sheriff's Department and a couple other people here and there, interns and such, have worked really diligently with the Find Help team to customize the site to make it easier to access for our community and to make sure that the information on it is as we need it to be. So the goal and what we've created really is one place for community members to point to, for service providers to refer to or direct people to, where info is kept much more up to date, because each agency in our county has the opportunity then to have their information on the site, and they can it's called claiming your card, and then they can be the ones to ensure that their information stays updated.
Absolutely. Can we talk a little bit about why this is such a valuable tool? What kind of services are on the website, and who is this designed for? Is there a certain demographic that we're trying to aim with this, or?
So really, you can find basic needs, housing, food, community meals, help paying for transportation, emergency housing, medical, dental, vision. We have categories that we've created that have 9 other drop-down categories. We were pretty purposeful in how we defined them, and again, basic needs, but addiction and recovery services, safety, education, work, money, legal, family, and children. And then I'm kind of most proud of our community connection, because while we want individuals to find those resources, community connection is so important as well to the overall health and well-being. So that might be the LGBTQ plus community, seniors, but we also have public libraries, neighborhood programs, faith-based organizations. So it's not just your traditional resources that you can find, and it's really for everybody, including individuals like Sam and I who are helping the community. I have one place I can go to now and don't have to rely on a paper guide. And so can our community members, because like you said, they can be out of date.
It's a really good point there. It's not just for the people who are searching for help. It's for people who are searching for help for other people, potentially.
Mm-hmm. Yes.
Okay. So for those of us who may not be tech savvy, who might not be that handy on the computer, how easy is it to navigate the site?
We tried to make it as easy as possible. So there are so many different ways you can search. You input your zip code, so it's getting resources more local to you, and then you can search so many different categories and subcategories that you can get pretty specific in your search in terms of what you're looking for. We also tried to make it even easier for specific populations. So on the landing page of the site, if you just input the URL, you land on that site, then you're going to see, like we, for example, have a college students folder and a veterans folder and different folders for specific populations, so that if you fall within that population, then you can just click that button, and then it's a tailored list that we've generated specific for services designed specifically for them. Ultimately, when it is online, that can be a barrier for some. We've tried to combat that with all of the different outreach and marketing materials that the health department, especially Carrie, has worked on designing. So we have, magnets and cards and all different variations that has the QR code so people can scan. If they can't scan, then a lot of times we put the URL there too so they can look it up. Right now we're working on trying to push it out in the community even further. So for example, we're working on getting it on the bus kiosks around town so people become aware that way, and trying to see whether it's possible to get it on the computers at the library. So we're really trying to push it out there largely so that we're not, just so that people are more aware of it, and so that you don't necessarily have to scan the QR. We want people to say, oh, I can just look up Porter County Find Help, and then it's going to pop up for me. So
nice.
Yes, a lot of goals still coming down the pike for this site.
Yeah, and you can even just type in a keyword, food, and you can look that way if you don't want to use the drop down. I personally use both. And we also made it so that if you type, you're in Valpo, but maybe you want to know of a resource in Portage. A lot of our listings in Valpo, it'll pop up regardless of zip code or Porter County, and then you can sort by relevance or what's closest to you. So there's really some good navigation ways to find what you want.
Absolutely. And I do just want to say on a side note, on our YouTube page, the Porter County Health Department YouTube page, you go there, you will see a nice little archive of videos, and you just type in Find Help, and you will find these two young ladies telling you all that you need to know about Find Help. There's a little tutorial on there. It shows you everything that you need. So please go to our YouTube page and just type in Porter County Health Department Find Help, and the video should come up to give you a better idea of what this website is all about. So thanks for that information, ladies. I believe, Sam, you touched on this a little bit earlier, but I really wanted to emphasize the importance of this. Organizations need to claim their page. Can we talk a little bit about the importance of that and how that will make your life a little easier?
Yes, definitely. So to the point that I made earlier, it's absolutely not feasible for 2 or 3 people to keep every agency throughout the county's information updated. So when an agency claims their page, it's essentially saying, yes, I work here, I'm knowledgeable, and can rightfully go and update this information. So for example, when maybe an agency's hours change, then we don't have to we used to have to suggest that a change be made, wait 48 hours, something like that, and then the Find Help team would make it. So the site over time has been adapted so that we actually have a lot more ability to edit our own site, whether it's us doing it or ideally the agencies throughout the community doing it. So it's really just giving them the access to change the information on their program card as they need to keep it relevant.
Okay. So how do we go about doing that? If you're an organization, you just need to,
take it away. You do that.
So if you end up on the main website, which I have pulled up here, I know it all, but usually on a computer, it's the top bottom corner, and it says Claim Programs. It's you talked about if you're not tech savvy, it is really very user friendly. It's easy to use. I'm pretty tech savvy. But I will even sit and do a Zoom meeting and walk someone through it. So if you're not sure, you're not comfortable, we'll help you get through it. But it is so important to claim your page, because then you can edit it really kind of up to date with if tomorrow, you're going to be closed. You really could put that on there and use it. But yeah, claim your programs. It walks you through it. The other cool thing about the site is they have a support page, and they have instructional sheets to kind of walk you through step by step. I've used them, and they're very easy to use.
Awesome. So even though it's you two and a few other individuals, you mentioned interns, another social worker that's really working to keep this site up to date and whatnot, but it really is going to take a community effort to make sure that this resource is in tip-top shape and the condition, what am I trying to say? Trying to make sure that it is up to date as much as possible. So it is going to take a real community effort with everyone claiming their pages to make sure that that information about your services are out there.
Absolutely.
So, yeah. Let's talk a little bit more about teamwork. So how do we ensure that the information on here stays current and accurate? How often are we meeting to update this information?
Good question. So the resource network as a whole meets monthly. So we're constantly sending out reminders to keep that information updated. For agencies that are not within the network, we've been working on designing this card claim campaign to push out to the community. So ideally, regardless of whether someone is involved in the network, they would be hearing about it and and be able to go in and do that. But the Find Help team itself also goes in, and annually at least, they're going and reviewing program cards and reaching out. The challenge is usually they're not based locally, and so it's a lot easier for Carrie or I to look at a program card and say, hey, that's not updated anymore, and then go in and change that, or ideally reach out to the agency and say, hey, we noticed that this information is out of date, this is how you could claim it, so you could always update that. So we have kind of the safeguard of Find Help going in and doing it, but it's a lot more effective to do it locally and just keep encouraging our agencies in the network and educating people on how and why we would want them to claim it and update them.
Understood. So let's look to the future a little bit. let's get a crystal ball. We're fortune tellers. We got our cool little hats on with a little diamond in front. We're fortune tellers right now. So to the future. What do you see as the future? How do you see Find Help evolving in the upcoming years?
So I actually have always kind of had a vision, and my vision is to get rid of paper guides. While they are great and they do work for some, and for a while there I was still using them, but just to have most accurate, up-to-date information, and I'd love for all of Northwest Indiana to use our website. I've promoted it at an event in Lake County, even though we were there kind of representing Porter County. I said, you just don't have to live in Porter County. You can use our site to find resources in any county. You just search by zip code. I would love for every organization to claim their page and really take that ownership to promote their program. And because Sam and I and a few other individuals, we have other jobs, and I feel like managing this site could be a full-time job. So just to increase that collaboration and have everybody use it.
Understood.
I would just add that part of my vision has always been to do this well in Porter County, but then also be creating a model that other communities can use. So when Carrie talks about promoting it in Lake County for the purpose of people being able to search on our site, I also would love to see other communities, and other communities actually have looked at our site and said, oh wow, we would love to do something similar. There's a lot of legwork, of course, behind it, and money and time, but for communities that are lacking what we're fortunate to have through this site, I would love to just make it easier and more well-known for other communities to do the same thing.
I've actually seen some clips on Facebook for Find Help in different communities. I haven't seen one for Porter County specifically, but it does seem that it's gaining traction. I mean, if you see it on Facebook and the little clip section, the reels and whatnot, so it does seem like it's picking up some traction.
We know a communications manager who might be able to hook us up with that.
Might. That might be our next project, actually.
It might be.
It might be. I don't mind that at all. Let's talk a little bit about collaboration between the departments. So one of the main purposes of this program, the PoCo Wellness Hour, right here on WVLP 103.1, is for us at the health department to point out those different partnerships and initiatives that we're taking part in. So the two of you coming from different departments, health department, sheriff's office, can you talk a little bit about how your collaboration came to be? Was Find Help the magnet that brought you two together, so to speak, with the way that you two work with each other? Would that be a fair way to say it?
Yeah, I think we had been running around in similar social worky circles for a while before that, but I don't think that we had actually collaborated directly until this site came to be. So it would have been pretty early on that in this project that I went in front of the Board of Health and talked about it. And then I believe that when Carrie was hired in, they had already, the Board of Health had already essentially adopted the project. But it was just a huge blessing to have her join, because then we had I had a partner, I have a partner in getting the site running in much better condition. So without this partnership, there's no way that the site would be in the condition that it's in. And I think since we got connected through Find Help, there's been many other initiatives and programs that we've started collaborating, both between us and between our agencies as a whole.
Yeah, and I honestly think it was the three of us that kind of got it going. When I started, I remembered going up to you, well, I'm leaving my current position, I'm going to be starting at the health department, and you're like, we need to talk. And the first day I reached out to her and I was like, let's get this going. And it's been a journey. It really has been a journey to get the site to where we want to. They've been really great at listening, and I think we're definitely on the right track and have more vision. And
so you guys have different positions, different departments, but similar roles when it comes to helping people. Can you talk about how your roles complement one another when you're managing the website and helping people get connected to the services here in Porter County?
Ooh, that's a good one.
Getting deep on you.
Well, I would say if we're talking about why we can work so well together on it, partially I would say Carrie is usually the go-to when somebody needs help with the techie side of their, whether it's claiming their page or updating their information or getting the program card listed initially. We usually send people to Carrie. I think also just having two brains focusing on it makes it when something doesn't make sense to one of us, usually we can.
Yeah, usually we understand, especially when we're meeting with our customer service manager, she might be trying to relay something and they're not understanding, so I can kind of word it in a different way. But then even just on our site and collaborating and getting it to where it wants to be, she has a different lens she's looking at, as you mentioned, from the sheriff's department and being a social worker, and then mine just kind of being in the community, maybe family and children resources. So we are have different views, and I think it's a good complement, and we balance each other out. Mm-hmm. At times, one's more outspoken than the other, maybe me on frustrations, but and then other times, she has her frustration, but I think we balance each other, and we just know we can go to each other for help.
Awesome.
And I think for our agencies to know mm-hmm. that we can rely on each other, as whole entities, is really helpful too. I don't think that the partnership that we have with the Porter County Health Department is mm-hmm. incredible, and I don't see that happen in a lot of other communities where we're able to work so effectively and so closely together.
You kind of just jumped into my next question. I feel like you're reading off my script here. So do you think teamwork like this could be a model for other counties in Indiana? The partnerships and the teamwork that you two put on display every day?
Yeah, absolutely. I've seen it. I think we've both seen it where mm-hmm. other counties have looked at what we've been able to build and expressed that they would really like to do something similar. I know a lot of times when I'm out doing outreach or whatever work I'm doing in the community that day, especially if other communities are involved, and I hear all the time the health department, a lot of counties have a negative taste or sense for the department. And I always say, ours is the absolute best, and our partnership is the best. And I think that helps to kind of start rewriting the narrative and helping other counties or communities recognize that it can be different, and it can be that positive relationship. So I think, yes, absolutely possible, and I think that it started to happen. Yeah, and I kind of am always saying, our sheriff's office, our police departments, they're great. We have social workers that are really helping to educate them on mental health, and really just it's not about putting individuals in jail and them being in trouble, and I'm always saying, CM's great. And I hear about her when I'm out helping people, and at the end of the day, it's not a competition, and we're here to work together and help make a better community.
Not competing.
No.
We're competing to make our county as best as it can be.
Okay, well, we will compete for that, yes.
Well, I didn't mean it to correct you. I'm just saying.
Okay, yes, but she and I are not in competition.
No, you guys are definitely collaborating with one another. Is there anything else that you want to add about Porter County Find Help? Did I leave anything out? Like I said, I wanted to emphasize the importance of organizations claiming their page. I feel like that's really going to bring everything full circle, not just for you guys, but for the whole community. Is there anything I left out when it comes to Find Help? The only thing I can think of to add is that I do always like to make sure people know that part of what makes our Porter County site so valuable is that we can list whatever resources and services we want. So anybody, nationally, people can access Find Help
as a free website. Because Porter County bought into this paid white label, that allows us to list other services too that wouldn't qualify to be listed on the free national version of Find Help. So, for example, in order for a program to be listed on the free Find Help version, it has to have free or sliding scale services. So what we were seeing when we initially tried to cut the cost out and use the free version, we were noticing that a lot of the programs that we were referring people to they were deemed unlistable on the site because maybe they take insurance. So for example, I was getting a lot of people saying, I need in-home health care, where can I go? And so I was referring to my paper list because I couldn't have them listed on Find Help. Insurance would cover that for the person, but it couldn't be listed. So anyway, any program service can be listed on our Porter County site, regardless of the free or sliding scale services. So I think that's important for agencies to know if they're not already listed on our Porter County site and want to be.
All right. Okay.
And yeah, I'll kind of add to that. Like at the end, like we can add what we know are resources, but there's so much more out there that we don't know about, and we need everybody's help in getting them added. It doesn't need to be that organization. If you're a community member, let us know. Hey, I know of this really cool resource. We'll get it added. We have that capability to look into that and add it. Or if you're a provider and you want your services listed, like we said, we'll help you get it added, or we'll let you take the reins on that and manage it all you want. But yeah, it's not just for someone who is low income or depending on their living situation. It's for everybody. So
understood. Local organizations, we can't stress enough how important it is for you to claim your page. And for those who may be listening, going through a hard time, who need some help, there are resources out there. There are tools for you. And this Find Help Porter County might be just what you need. Okay, ladies, let's go to our next segment, if you don't mind. June being Men's Mental Health Awareness Month. I wanted to talk a little bit about this with you because you guys are well in tune with the community. You guys help so many different people. I wanted to talk a little bit about this. So June is Men's Mental Health Month. We know that men often don't seek help as often as probably what they should. What are some of the common barriers that you think men face when it comes to getting support, especially for mental health? I'll start with you, Sam, if you don't mind.
Yeah, I feel like half my role sometimes is trying to address the stigma that prevents so many people, especially men, from talking about it and seeking help. So
there is a stigma, you would say.
I think that's probably the biggest barrier, is that the way that we have for so long socialized our boys and men to be ashamed to talk about it or to not recognize it. I think a lot don't recognize when there's an issue, but even if they do, like, there is so much stigma that I know it can be super challenging to reach out for help. I see a lot of fear, like being viewed as weak or lesser than if you admit that you need help. So I would say that's the big barrier. Also, it's really challenging when somebody finally does admit that they need help, and then there's still barriers, whether it's insurance or finances or all of the above. There's definitely, in terms of mental health support, there's a lot of new, awesome resources available, but there's still long wait lists and high copays and all of those other things that make it really challenging for people to get the support they need.
What about you, Carrie?
I agree with everything that Sam said. Typically, I don't really experience men having a hard time asking for help. Even our bicycle program, I'm giving a lot of those out to men, so I'm glad that they're reaching out for help.
Absolutely.
And depending on their circumstances, I might be giving a 988 card in their bag, and I try to put that in there, or a crisis center, just so they know they're available, and kind of respecting their privacy. But it's hard, and there are still some resources that just aren't out there for men. So
understood. once again, the main theme of this show is to talk about Porter County Find Help. So for the listeners who are listening to our program today, can they go to Find Help? Are there programs that are kind of tied for men to kind of help them with what they're going through as far as a mental issue or even some kind of physical issue, I should say?
Yeah, we definitely have different counseling services on there, different support groups, different peer resources and networks. There's a lot of ways. Not off the top of my head, I don't think we have. We definitely do not have like gender specific categories listed on there, but we do have descriptions of all the programs and the resources that are listed, so they could see if it was a fit for them.
There is some help,
yeah.
though.
Yep.
Understood.
Yeah. A lot of barriers, but if the resource, there are certainly mental health resources listed on the Find Help site.
So, Carrie, what message would you want to send to men in the area who might be hesitant to reach out to seek some of these services, to seek some of this help? What words of encouragement would you give them?
So there was a post recently on the Porter County Suicide Prevention and Awareness Task Force. It's a Facebook page. And it was just a message to men. You are not weak if you ask for help. And anybody who asks.
It's a good note right there.
And what it says is men cry, men break down, men get anxiety, men feel insecure, men get abused, men have emotions, men have mental illnesses. It's not unmanly to struggle. Let's support men. Let's encourage men. Don't belittle or silence men. Men struggle too. And my biggest message is it takes great courage to ask for help. That's the hardest thing to do.
For anybody.
It is for anybody.
If you're female or male. Doesn't matter. Understood. So we're getting close on time here. Wow, this has been a really good conversation, ladies. I really appreciate your time here today. So have you noticed any trends or improvement in recent years when it comes to men taking steps to prioritize mental health or even physical well-being? I feel like over the past few years, maybe the past decade or so, the whole stigma behind mental health has really kind of gone away. We've kind of beat it down a little bit. The stigma does still exist, as we talked about earlier, but I feel like maybe here in Porter County, at least, we are addressing those mental health issues a little more seriously. Do you think that translates to men in the area?
I think my perspective is unique because I'm working with mostly men in law enforcement, and the stigma, I think it's getting better. Even just since I've been in the field, I've seen a positive shift, but still a lot of stigma, a lot of fear of being viewed as weak by asking for help. So in certain settings, I think it can be even more challenging to kind of overcome that, and there's a lot of fear that maybe people will think I can't do my job anymore. It's always what people think, but as a whole, I don't see that as much of a barrier in other settings necessarily out in the community. It's definitely still there. I would say it's concentrated in some professions and settings, but overall, as a whole, I would say it's gotten better. I've definitely seen a shift in the right direction.
But we still have some work to do.
Still have some work to do, yes.
What about you, Carrie?
So I'm going to mention veterans. So, we have male and female veterans. I think that we're doing a little bit better with promoting help for our veterans, whether they're active duty or no longer. There's some really cool programs out there for men struggling or even any veteran struggling with mental health. And so I'm glad that we're getting there. I think we have a long road. Even talking about 988, which is a crisis suicide hotline that anybody can reach out to. That's and a lot are still not aware of that, and that kind of goes along with if you're having a mental health crisis or just struggling, reach out. There's always that for to reach out to 24/7, and if you need resources, you can reach out to either one of us, and we are happy to help. No judgment.
So can you talk a little bit more about the suicide prevention Facebook page? Where can people find that? What is the
address
of that, please?
Yes, it is called, and I will say there are posts on there, a lot of them addressing men's mental health and new dads and things like that, trying to hit every population. Porter County Suicide Prevention and Awareness Task Force. and it is a black and white logo. And yeah, you can find that even on my page. If we don't have it on my care coordinator page for the health department, we're going to get it on there today. But yeah, it's really just understanding, learning how to do self-care, men, women, moms, I mean, anything. I know we're talking about men, but there's several videos that are posted on there, and you know, it's really just okay to ask for help, trying to normalize that, really.
Sorry, go ahead.
Sorry,
Go ahead,
if I could also give a shout out to the Board of Health for one of their new initiatives towards addressing both mental and physical health, and to answer your question some more about stigma. So the RFA came out asking for physical activity initiatives to help fight adulthood obesity in Porter County, and one of the examples on that request for apps was yoga. And so the Board of Health actually gave funds to a partnership between the Sheriff's Office, Recovery Connection, and Community Change Center, my nonprofit, to do yoga targeting both first responders and those who are in the recovery and reentry populations. And to your question about stigma, when I created a flyer and took it to the department and said, we're doing yoga here starting in June, a lot of people were like, we are what? I never thought I would see the day. And like stigma still alive and well, but the fact that they said, okay, we might think it's weird and this might feel really uncomfortable, but we're going to try it, was a huge step. The fact that the Board of Health recognized that and supported it is huge. And it's really incredible to be able to have these sessions where we can actually talk about the connection between physical and mental health and promote that among populations that typically don't have access to the resource. So thank you to the Health Department and Board of Health.
Absolutely. You know, sticking with the whole yoga thing, I feel like there's something with that. You know, you have to be a little uncomfortable sometimes in order to make yourself more comfortable in the future, because you can definitely be uncomfortable in a yoga class. I've taken part in a few of them, learned some cool new stretches, you know, to get myself out of bed and whatnot. But I feel like that program is right there. It's just a really perfect metaphor for life a little bit. Sometimes you got to go through a little bit of an uncomfortable stage in order for you to feel better later on. And at least that's what I take from yoga class. Yeah. We do all those stretches and whatnot. Ladies, we're getting close on time here. I do want to thank you for your time here once again on the PoCo Wellness Hour right here on 103.1 FM WVLP. Is there anything that you want to add to today's conversation, whether it's about find help, whether it's about, you know, ending the stigma thoughts, anything about the resources here in Porter County? Did I leave anything out in our hour conversation that you think I should have included?
No, I would just say, in case we didn't already direct people, if you're trying to access the site, portercounty.findhelp.com. If you're an agency looking to update your card, claim your card, whatever it may be, reach out to Carrie or myself with questions. But thank you for having us.
Absolutely.
Yeah, thank you.
Absolutely. So we hope you learned something today, Porter County. We hope this conversation has left you inspired. And remember, a healthy community starts with each and every one of us. For more information on events and programs and initiatives that we discussed today, you can follow us on our websites. You can go to the Porter County government website, which is www.portercounty.in.gov, or you can go straight to our health department website, www.in.gov/local health/Porter County. Or you can find us on social media. You can find us at x.com/county_Porter. You can find us on Facebook, facebook.com/Porter County Health DEPT. Or you can find us on Instagram at Porter_County HD. Once again, this is Demetrius Lewis, Communications Specialist for the Porter County Health Department, and I am signing off right here on the PoCo Wellness Hour on WVLP 103.1 FM, your show for health, community connection, and overall well-being. Have a safe and healthy week, Porter County. Peace.